So if someone isn't getting insurance through their employer, can they just go directly to the insurance company as opposed to going through one of these brokers?
It's very difficult, but you need to go through some intermediary. People should recognize the government has public exchanges. If you go to healthcare.gov or other sites, there are resources to point you in the right direction. Beware of these skimpy plans, but at the same time, be open to alternate insurance products that may be a better deal, like faith-based co-ops and health shares and health savings accounts. These can be very good plans for a lot of people, and they put their terms in very plain English so you can understand them.
Trish, I mean, after this all played out, you didn't get anything covered. I mean, you tried to find this broker and he was unavailable.
Correct. Yeah, we tried to call his number and it was disconnected.
So what in fact did you have to pay out of pocket after your accident?
It came to about $36,000.
Dr. Makary, does Trish have any recourse in a situation like this? I mean, it seems very misleading and it seems
illegal.
Deceptive and
illegal.
That this website she went on initially was made to look like a government marketplace.
Well, first of all, Trish, I feel terrible about this. I want you to go to restoringmedicine.org, where we've got 20 things you can do to fight your medical bill. That's number one. Number two, that insurance broker should either be out of business or in jail. That is crazy. You've been treated unfairly. Healthcare was never meant to be like this. We're supposed to take care of people when they're vulnerable, not take advantage of them. And so report him to the state's attorney general, report him to the Better Business Bureau, and put Google and Yelp reviews and other online ratings, and let him know just before you put them up, do you think this is fair for me to put it up? And that gives him an opportunity to try to salvage the situation, because the brokers can sometimes cut deals with the insurance companies.
You mentioned a faith-based co-op as an alternative. Can you talk about what a faith-based co-op is?
Sure. So these are sort of pools of money with very low administrative costs, Nita. These are companies like Samaritan Ministries or MediShare, and these are exempt from the Affordable Care Act rules, and they can operate with lower operating costs, and they can be a great option. I tell people all the time, you may want to choose a high deductible plan, and you'll have a much cheaper premium. Save the difference of that money, your savings each month, to a rainy day fund. I bet you'll come out on top at the end of the year, especially if you shop wisely for your medical care using resources like MD Save, Free Market Medical Association, Health Shop, and Sesame Health. There's a bunch of these out there. It's the future. It's just a matter of whether or not you know about these, but there's great ways to shop for care.
So Trish, any last word? What is your recommendation to people out there listening?
Ask a lot of questions. I thought I had asked enough, but apparently not. So if you think you're done, ask 3 more.
And Trish, how much do you still owe?
I had about $12,000 I'm paying off monthly. I had pulled money out of my retirement account to mitigate some of them.
That's not the way it's supposed to be. Well, Trish, we reached out to MD Save, which partners with quality providers all around the country to make healthcare transparent, shoppable, and affordable. Guess what? They're going to be providing you with $3,000 to help you with your medical bills.
Wow. Thank you. That will help a lot. Wow.
Thank you, Trish. And as always, Dr. Makary, thank you for guiding us through this.